2/3 of young adults skipped medical appointments last year, not because they forgot, not because they were too busy, because they looked at the bill and made a rational economic decision. Over the past year, 65% of Americans delayed or skipped healthcare appointments. Gen Z led the trend, with 68% having done so. Let that number sit for a second. Nearly 7 out of 10 people in the healthiest demographic in the country are actively avoiding the one system designed to keep them healthy. And here is the part that gets strange. Among Gen Z, 80% say healthcare costs are at least somewhat of a financial burden on their household budgets. 80%, that is not a fringe group. That is almost everyone. 35% of Gen Z consumers paid at least part of the cost of their most recent healthcare visit out of pocket, compared with 14% of baby boomers and seniors. So you have a generation that pays proportionally more out of pocket, earns entry-level wages, carries student debt, lives in the most expensive rental market in American history, and then gets handed a $300 bill for a 30-minute appointment with someone who spent less time with them than the parking meter did. And the headline becomes, Gen Z is irresponsible with their health. That is the wrong frame, completely wrong. And this video is about why. We are going to explain how the healthcare cost system actually works, why it is producing a very predictable behavioral response in younger adults, why that response is being replaced by something arguably more dangerous, and why the long-term financial and health math on this is much darker than anyone is currently running. This is not a medical advice video. I am not a doctor. I am a 26-year-old who reads a lot of papers, tracks systems for a living, and thinks that incentives explain about 90% of human behavior, including the behavior of skipping your annual physical. The central metaphor I want you to hold for this entire video is deferred maintenance on a car. You know you need an oil change. The mechanic wants $200. You think the car is running fine. You skip it. You skip it again. A year later, the engine light comes on. 2 years later, the engine seizes on the interstate, and the repair bill is $8,000. The $200 oil change that you kept avoiding for 2 years just compounded into a catastrophe. That is what Gen Z is unknowingly doing with their bodies and their finances at the same time. And the system built the conditions for this to happen. Hold that thought. Let me start with the cost structure, because I think most people misunderstand what is actually happening here. The common assumption is that healthcare is expensive because medicine is complicated, doctors spend a decade in school, and equipment costs money. All of that is true. None of that fully explains the structure. Between 2022 and 2023, healthcare spending in the United States increased by 7.5%. Between 2023 and 2024, spending rose another 7.2%, amounting to over $15,000 per person. $15,000 per person per year. For a 23-year-old making $55,000 a year, that is roughly a quarter of their gross income going into a system that they are not fully using and in many cases not fully covered by. Now add the premium cost. In 2025, average monthly premiums on the ACA marketplace range from about $380 for bronze plans to over $510 for gold plans. So if you are an uninsured or underinsured 25-year-old buying your own coverage, you are paying somewhere between $4,500 and $6,000 per year just for the insurance. Before you see a single doctor, before any deductible, before any copay, just for the theoretical right to access care at a slightly reduced price. And the deductibles on the cheaper plans can run between $3,000 and $7,000. Which means you are paying $4,500 a year for insurance, and then the first $3,000 to $7,000 of actual care still comes out of your pocket. Do the math on that. You could be paying between $7,500 and $13,000 before insurance actually covers anything meaningful. For someone making $45,000 a year, that is not insurance. That is a subscription to hope nothing goes wrong. Over half of Gen Z, 55%, do not have enough emergency savings to cover 3 months of expenses. So you have a population with no savings buffer facing a healthcare cost structure that front loads the financial pain onto the exact period of life when they have the least money. And then we act surprised when they make rational decisions to avoid that system until they absolutely cannot. This is not laziness. This is expected output from a specific set of inputs. Now here is the thing about that deferred maintenance analogy. When you skip the oil change, nothing happens immediately. The car keeps running, you feel validated, you skip it again. The problem with human biology is exactly the same dynamic. You skip the annual physical, nothing happens immediately. You feel fine. You skip it again. And again. And at some point, the thing that a routine screening would have caught in 2 years becomes the thing that costs you $60,000 to treat in year 7. In the first year of breast cancer treatment, the average cost of treating more localized breast cancer is $60,637 for stage 0 cancer, or $82,121 for stage 1 or 2, while treatment costs are higher for later stage breast cancer at $129,387 for stage 3 and $134,682 for stage 4. Early detection, $60,000, late stage, $134,000. Double the cost, and a fraction of the survival rate. Studies in high-income countries show that treatment costs for early diagnosed patients are 2 to 4 times less expensive than treating those diagnosed with advanced stage cancer. A United States study estimates the national cost savings from early diagnosis at $26 billion per year. $26 billion a year. That is the value of the oil changes we keep skipping. But here is the reversal that the standard narrative misses entirely. You think the problem is that Gen Z is making bad financial decisions. Actually, they are making extremely coherent financial decisions in response to a cost structure that was never designed to serve them. The problem is not the decision. The problem is the system that makes skipping the doctor the most logical short-term move. And that system has specific incentives, keeping it exactly the way it is. Let me bring in the 3 levels. Because when I look at why Gen Z is not going to the doctor, I see 3 separate problems that people keep collapsing into. 1, and collapsing them is why every proposed solution misses the target. Level 1 is logistics. The visible, surface level stuff. Cost, time, scheduling, phone calls. Level 2 is trust. The deeper, structural erosion. They do not believe the system is working in their interest. Level 3 is replacement. The alternative system that moved in while the official one made itself unaffordable and untrustworthy. Most think this is a level 1 problem. Fix the cost, fix the behavior. But the cost is just the door. Behind it, there are 2 more rooms. And the third room is the one that makes the long-term situation genuinely alarming. Let me run through them in order. Level 1. Logistics. Nearly half of Americans cited logistical barriers like trouble taking off work, while almost 40% said prolonged wait times had led them to cancel or delay an appointment. More than half of Gen Z adults, 55%, reported they are less likely to schedule an appointment if it requires calling a healthcare provider's office. Phone call. That is a barrier. You could argue this is generational phone anxiety, which is a real thing, and the jokes write themselves. But let me give you the more structurally honest read. The healthcare system was designed in a world where the patient had no leverage and no alternatives. You called a number, you waited on hold for 40 minutes, you navigated an automated menu, you scheduled something 3 weeks out, you took a half day off work, you sat in the waiting room, you saw someone for 12 minutes, you got a bill 6 weeks later for an amount you did not anticipate. For a generation that can order food, book a flight, and manage their entire financial life from their phone in under 5 minutes, the medical appointment process is not just inconvenient. It is a signal that the system is not adapted, does not respect their time, and is operating on its own schedule, not yours. Urgent care centers and emergency departments have become the primary source of care for a growing number of younger patients. So instead of a relationship with a primary care physician who knows your history and can catch things early, you get transactional urgent care. You show up when something is actively wrong, you get treated for the acute problem. Nobody looks at the bigger picture. You leave. That is the deferred maintenance model applied to medicine. Now level 2, trust. This is the part that tends to make people uncomfortable because it requires acknowledging that some of the distrust is earned. Nearly a third of Gen Z reported not liking or trusting their doctor, or feeling embarrassed with them, the highest percentage of any generation. 45% of adults age 18 to 34 said they have disregarded their health provider's guidance in favor of information from a friend or family member in the past year, a 13-point increase from the previous year. 38% of young adults said they have ignored their provider in favor of advice from social media, a 12-point increase from the year before. Those are not small numbers, and they moved 13 points in a single year. Trust does not erode that fast on its own. Something accelerated it. Here is what I think happened. Gen Z grew up watching their parents get surprise medical bills. They watched insurance companies deny claims. They watched the COVID-era medical establishment change its official guidance multiple times in short windows, which from a trust standpoint is damaging regardless of whether those changes were scientifically justified. They saw the opioid crisis unfold as a largely physician-driven catastrophe. They entered adulthood reading stories about prior authorizations, about insurers denying coverage for procedures doctors ordered, about billing errors that sent people to collections. 61% of United States respondents across all age groups said they feel business, government, and non-governmental organization actions hurt their ability to get quality health care. More than 6 in 10 people believe the system is actively working against them getting good care. That is not a fringe conspiracy theory. That is a majority position. And when the majority of your customer base believes your product is designed against them, you have an incentive problem, not a communication problem. Now let me show you where the money actually is. Because incentives tell you everything. The 7 largest publicly traded United States health insurance companies reported a combined $71.3 billion in profits for 2024, setting a new record. Despite rising out-of-pocket costs and millions losing coverage, United States health insurance giants posted record profits in 2024, while their CEOs took home a combined $146 million. $71.3 billion in profits, $146 million to 7 executives. The 7 largest for-profit health insurance conglomerates took in nearly $1.7 trillion from their customers in 2025 and booked more than $54 billion in profits. And here is the structural insight that I want you to actually internalize. $12 billion of customer premiums and other healthcare spending was used by these companies to buy back their own shares of stock to boost earnings per share, which benefits shareholders and top executives. So part of the money you pay in premiums does not go toward your care. It goes toward making the stock price look better for institutional investors. That is not a conspiracy. That is publicly reported financial data. The incentive structure of a for-profit insurance company is literally to collect premiums and pay out as few claims as possible. That is the model. When Gen Z looks at the system and decides it is not working for them, they're reading the incentives correctly. The trust is not irrational. It is a rational response to transparent incentive misalignment. I am not here to tell you the whole system is evil. I am here to tell you that the system's incentives point in a specific direction, and that direction is not toward cheap preventive care for 23-year-olds. If you have been watching this channel for a while, you already know I do not post for the algorithm. I post when I have something worth saying. If you want to think about money like a system instead of a feeling, hit subscribe. The next few things I am going to show you in this video are the parts that actually change how you operate. Now, level 3. The replacement. This is where it gets genuinely strange. And I want to be clear, I am not going to mock Gen Z for using TikTok for health advice. I am going to explain why it happened and why the dynamics of it are more problematic than the surface joke. When a system becomes too expensive, too bureaucratic, and too distrusted, human beings do not simply go without. They find alternatives. That is basic economics. That is what happened here. A CharityRx study revealed 1/3 of surveyed Gen Zers use TikTok for medical advice, and 44% turn to YouTube before consulting their doctor. 1/3 of Gen Z say they are already acting on influencer advice, with 33% reporting they have let a content creator with no medical training influence a personal health decision. Gen Z are also twice as likely as older adults to let people without formal medical credentials influence their health decisions. Now, comedic cutaway moment. Imagine going to your doctor and your doctor says, I spent 8 years in medical school and I'm seeing 40 patients today and I've got 12 minutes for you. Then imagine going to a creator on TikTok who says, I had this exact thing, here's what worked for me. Follow for part 2. One of these people has credentials. The other one has 37 million views and good lighting. And somehow the one with the views is winning. That is not a stupidity problem. That is a trust and accessibility arbitrage problem. But here is the actual danger. Because I am going to be honest about both sides of this, around 44% of health videos on these platforms contain non-factual information, videos from non-medical influencers, content creators with over 10,000 followers who did not self-identify as medical professionals, accounted for almost half of all videos, and were more likely to contain misinformation. Over 83% of mental health advice on TikTok is misleading, according to recent studies. 83% of mental health advice misleading. And yet, with more than 2 in 5 Gen Zers in therapy for conditions including depression, anxiety, and stress, according to one survey, even those with insurance face rising out-of-pocket costs. Claims for behavioral health services spiked 45% between January 2023 and December 2024. So you have a generation dealing with a documented surge in mental health challenges, getting their mental health advice from a system where more than 80% of the content is misleading, and avoiding professional help because the cost is prohibitive. The 3 problems I described are not separate, they are a pipeline. Nearly 60% of young adults say they have made at least one health decision they regret based on inaccurate or misleading information. 6 out of 10 made a health decision they regret because the algorithm served them something confident, clear, and wrong. And the official system was too expensive, too slow, and too distrusted to compete. The replacement is not just a quirk. It is a parallel health infrastructure operating with no quality control, no liability, and no longitudinal view of anyone's actual health. The TikTok algorithm does not know your family history. It does not know your blood work from 3 years ago. It does not know that your fatigue is not a magnesium deficiency, but an early thyroid marker. It knows what kept you watching last Tuesday and is optimizing toward the next piece of content that does the same thing. Your doctor is trying to help you. The algorithm is trying to retain you. Those are different objectives. Now let me run a concrete scenario, not a personal story, a composite, a realistic example of how this actually plays out financially over time. Call him Marcus, 24 years old, makes $52,000 a year. Gig-adjacent job, technically employed, has a bronze plan through his employer that covers the absolute minimum. His deductible is $4,500. His monthly premium is $190, which his employer subsidizes by about half, so he pays $95 a month himself. That is $1,140 a year. Marcus has not seen a primary care doctor in 3 years. Last time he went, he paid a $220 copay, waited 6 weeks for an appointment, and the doctor spent 9 minutes with him before recommending he come back in 6 months. He did not go back. Marcus is not stupid. He looks at the math, $1,140 a year in premiums, $220 copay to access care, potential deductible of $4,500 before anything is meaningfully covered. For a 24-year-old who feels basically fine, the rational short-term calculation is the probability that something serious is wrong is low, the certain cost of finding out is high, and the deferred cost is theoretical. That is a logical calculation. It is also the deferred maintenance calculation. Now let us say Marcus has a slow-developing condition, something that a basic panel at age 25 would have flagged. A borderline marker, something a doctor would say, hey, keep an eye on this, change these lifestyle habits, come back in a year. Marcus does not go at 25. He does not go at 26. At 28, he starts noticing something feels off. He does not go then either because he just got a promotion, he is busy, and he asks a few people on Reddit who tell him it sounds like cortisol or maybe low vitamin D. He orders a supplement. Nothing changes. At 30, something is noticeably wrong. He finally goes, the thing that was a borderline marker at 25 is now a confirmed issue at 30. And the treatment cost at 30 is not $200 and a lifestyle adjustment. It is closer to $40,000, multiple specialist visits, time off work, and a medication he will likely be on for the rest of his life with copays that compound every year. The deferred oil change became an engine replacement. The math across that 6-year window, Marcus saved approximately $1,200 a year in avoided copays and tests for 6 years. That is around $7,200 in avoided short-term costs. He is now facing $40,000+ in treatment costs, a chronic condition that will cost him hundreds of dollars a month in perpetuity, and a diminished earning capacity during the years that matter most for wealth building. The savings were real. The savings were also completely irrational from a long-term position. This is the deferred maintenance trap. The car keeps running. You feel fine. You run the short-term calculation correctly, and the long-term calculation not at all. Let me give you the macro version of that same story, because it gets darker at scale. 12% of United States adults, or about 31 million Americans, report they had to borrow an estimated total of $74 billion in the past 12 months to pay for healthcare for themselves or a household member. $74 billion borrowed in a single year. Not saved, borrowed. Nearly 1 in 5 young adults aged 18 to 29, 18%, report they needed to borrow to pay for healthcare. Similar rates are reported by adults aged 30 to 49. And the majority of Americans, 58%, are concerned that they would experience medical debt if they were faced with a major health event. More than half of all Americans are afraid of getting sick, not afraid of the illness, afraid of the bill. That is a system that has produced fear of its own output as the primary behavioral driver. When you are afraid to use your healthcare system because of what it will cost you to use it, you have a system that is functionally broken, regardless of how technically advanced it is. Here is the second order effect nobody is talking about in the context of wealth building specifically. Among adults undergoing foreclosure, 28 to 41% of individuals cited medical debt as contributing to the foreclosure of their home. And among adults experiencing homelessness, nearly 1/3 believe medical debt to be, in part, responsible for their current situation. Medical debt as a driver of homelessness. Medical debt as a driver of foreclosure. This is not a health story. This is a wealth destruction story. This is the mechanism by which one large, unexpected medical event eliminates a decade of careful financial building. And the people most exposed to this mechanism are the ones who have the least buffer, young adults with no emergency savings and high deductibles. Over 2024 to 2033, average national health expenditure growth of 5.8% is projected to outpace that of average gross domestic product growth of 4.3%, resulting in an increase in the health spending share of GDP from 17.6% in 2023 to 20.3% in 2033. So healthcare is growing faster than the entire economy. It is taking up an increasing share of every dollar generated in this country. And as it does, it crowds out everything else. It crowds out savings, it crowds out investment, it crowds out the compounding machine that builds actual wealth over time. A 2026 report by eBri found that some couples may need up to $469,000 in savings to cover their healthcare expenses in retirement. $469,000 just for healthcare in retirement, on top of every other retirement expense. So the 24-year-old who is skipping his annual physical right now is not just running a personal health risk. He is also setting up a future version of himself for a financial liability that compounds quietly for 40 years. Until it is enormous, he is deferring maintenance in a machine that gets exponentially more expensive to fix the longer you wait. Now let me anticipate the two most common pushbacks because they are both partially right and I want to address them honestly. Pushback 1. So what you are saying is we should all just pay for healthcare we cannot afford and everything will be fine. No, that is a completely wrong read of what I am saying. The cost structure is genuinely broken. The incentives are genuinely misaligned. I am not going to tell you that a 22-year-old making $40,000 should sacrifice their rent money to see a doctor for a checkup. That is a real constraint. The system has created a situation where the financially rational short-term decision is medically dangerous. That is not a personal failure. That is a structural one. What I am saying is that the deferred maintenance math is worse than most people realize, and that understanding it changes how you prioritize certain things even within a tight budget. Pushback 2. Maybe the generation just trusts different sources now. That does not make them wrong. Fair. Partially. Some things people learn from peers and online communities are legitimate. Doctors report more young people are seeking ADHD or autism spectrum disorder diagnoses after being exposed to social media content. Some of those people would never have gotten diagnosed otherwise. The democratization of health information has real upside, but the problem is not the information channel. The problem is the absence of quality control and longitudinal context. A peer who went through something similar cannot tell you how it interacts with your specific blood work, your family history, your medication. The anecdote looks like the data. It is not the data. Some 45% of young adults say the average person can know as much about health matters as trained doctors, a 7-point increase from 2024 survey data. That is a belief that will have consequences. And not because doctors are infallible. They are not. But because the confidence gap between what people believe they know and what they actually know tends to be where medical disasters happen. The person who knows they do not know seeks expertise. The person who is confident they have already figured it out does not. Now, let me do something a little uncomfortable, because I want to challenge a belief that a lot of people watching this probably hold. The belief is the healthcare crisis is mainly a political problem, and once the right policy gets passed, it will fix itself. Here's the more useful frame. Healthcare in the United States is not a system that got corrupted. It is a system that was built piece by piece with very specific incentives, and it is producing exactly the output those incentives reward. Expensive acute care, minimal prevention, high cost for the young and healthy who rarely use it. Subsidized care for the old and sick who use it constantly. Per person personal healthcare spending for the 65 and older population was $22,356 in 2020, over 5 times higher than spending per child at $4,217 and almost 2.5 times the spending per working age person at $9,154. The system spends $22,000 per year on the elderly and $9,000 on working age adults. The premium structure for younger people is comparatively low, but their deductibles are comparatively high. This creates a specific dynamic where young, healthy, low-income people have theoretical coverage and practical exposure to financial catastrophe. And as recently as 1994, all Blue Cross plans were operated as nonprofits. That began to change when for-profit life insurance companies like Aetna and Cigna started selling cheaper policies to younger and healthier Americans, leaving nonprofits with more expensive older and sicker policyholders. So the shift to for-profit health insurance specifically started with the demographic that is now most underserved. The model was built around extracting premium from the healthy while paying as few claims as possible. That model is not broken, it is working exactly as designed. The people it is not working for are the customers. Attacking the individuals running these companies does not solve this. They are responding to shareholder incentives. The problem is structural. The fix would have to be structural. I am not going to tell you what policy that fix looks like because frankly, that is a 20-hour conversation and this is not a political channel. What I am telling you is that waiting for the fix before you address your own deferred maintenance is a bad bet. Here is the most counterintuitive thing I want to leave you with. Gen Z is making rational decisions within a broken system. The system is producing rational short-term decisions that compound into irrational long-term outcomes. And the replacement system, the algorithm and the influencer economy and the peer health advice network is not actually cheaper in the long run. It just moves the cost somewhere less visible. Nearly 2 in 10 adults, 18%, report that their health got worse because they skipped or delayed getting care. About 4 times as many adults under age 65, 23%, say their health got worse after skipping or postponing care as adults ages 65 and older. 6%, most of whom have Medicare coverage. The people with the cheapest, most accessible care have the fewest deferred maintenance consequences. The people with the most expensive, most inaccessible care are the ones whose health is deteriorating because they cannot afford the oil change. And we get back to where we started. 2/3 of young adults skipping the doctor, not because they are irresponsible, because the calculation the system handed them makes skipping look like the smart move. It is the smart move, until it is not, and by the time it is not, the engine is already failing. 3 things I would actually do with this information. Not motivational, practical. 1. Run the deferred maintenance math explicitly. Get the numbers. What does a preventive visit actually cost you out of pocket, given your specific plan, after premium subsidies with your deductible? Compare that against the realistic cost of the conditions you are most statistically likely to develop, given your family history and your current habits. The gap between those 2 numbers is your real risk exposure. Most people have never actually done this math. They react emotionally to the immediate cost and do not model the deferred cost. 2. Understand what your plan actually covers for free. Under the Affordable Care Act, most plans are required to cover a set of preventive services at 0 cost sharing, meaning 0 copay, before your deductible. Annual physical, blood pressure screening, depression screening, certain cancer screenings. Many people do not know this. They assume everything costs money. Some of the highest leverage preventive visits cost you nothing if you specifically request them as preventive, not diagnostic. Know the difference. Know your plan. 3. Treat your relationship with a primary care doctor as a financial asset, not a transaction. The person who sees you every year builds context over time. They know what your baseline looks like, they catch the deviation before it becomes the emergency. Nearly 1 in 5 respondents said they did not have a regular primary care physician who knew their history. That context gap is expensive. Not immediately. Compounded over 10 years, the relationship is the leverage point. The car analogy one more time fast. You would not buy a car, pay for insurance, and then never change the oil because the oil change feels expensive. You understand that the car is the expensive asset and the maintenance is what preserves the value of that asset. Your body is the most expensive, most irreplaceable asset you own. The maintenance math applies identically. The people skipping the doctor are not wrong to be angry at the system. The system deserves the anger. But the anger does not protect you from the compounding consequences of deferred maintenance on the one machine you cannot replace or upgrade. That is the thing nobody is talking about. If any of this made you think differently about one financial decision, this channel exists. Subscribe and I will keep building the system.